Hello, everyone. Today I'm going to talk about using Xanax or alprazolam to sleep. Should you be doing that? A lot of us have problems sleeping at night. I get questions in my lives all the time. How do I get better sleep? And everybody always asks me, what's the best drug to take for sleep? Well, to start with, I would never start with drugs. Start with sleep hygiene, which I've done videos on in the past. Simple things. Go to sleep. Wake up at the same time every day. Don't take naps during the day. Don't drink a lot of water right before you go to sleep because you're probably going to have to get up to use the bathroom. Don't eat large meals because you don't want to have indigestion keeping you awake at night. Don't exercise right before you go to bed. Give yourself at least a couple of hours because you don't want those endorphins and epinephrine rushing around in your body, keeping you awake. Don't watch TV in bed. Don't watch your cell phone in bed. Don't watch YouTube videos in bed. Watch them on your TV while sitting on the couch. So those are just some basic sleep hygiene rules. Now, let's talk about Xanax. I'm going to give you 4 reasons that I don't think you should take Xanax for sleep. Reason number 1, Xanax is not indicated for sleep. Xanax is for anxiety, high anxiety, and panic attacks. It's one of the best drugs we have to stop panic attacks, but it is not indicated for sleep. That's number 1. Number 2, Xanax does not have a long enough half-life. That's the amount of time it takes your body to get rid of half of the drug by metabolism or excretion. The half-life is not long enough to keep you asleep for very long. It may put you to sleep for a short period of time, but it doesn't keep you asleep. There's better options, and we'll talk about those later. If you must use a benzodiazepine for sleep, you want something with a longer half-life. Number 3, Xanax increases fall risk, and this is especially dangerous in elderly patients, people that are older. You do not want to fall and break a bone. So this happens more with Xanax because you're less likely to stay asleep. And if you take one and you sleep for 2 hours or 2.5 hours, and then you wake up and you get up and walk around, there's still some of that in your system. Maybe not enough to keep you asleep, but enough to make you fall down. So it can be dangerous. And the last reason, number 4, which is a big one, is Xanax is addictive, as are all benzodiazepines. But Xanax is especially addictive because it has such a short half-life. It works really fast and it goes away really fast, which makes it even more addictive than other benzodiazepines. So, let's say that you're on Xanax for sleep and you've been taking it for a while. What happens if your doctor retires? Or decides that it's not good for you to take it for sleep anymore and pulls you off of it? It's going to be very difficult to find another doctor that's willing to prescribe Xanax for you for sleep because that's not what it's for, and doctors don't like using it because it is highly abused on the streets. So those are 4 reasons that you shouldn't use Xanax to sleep. If you must use a benzodiazepine, temazepam is a way better option. It has a longer half-life. It really is a better drug for sleep, but I don't even recommend that, especially if you are an elderly patient. Try sleep hygiene. Melatonin is about the only thing that I really recommend to sleep. The drugs like Benadryl also increase fall risk. They're highly anticholinergic. So they'll make you feel groggy in the morning. There's a lot of reasons why Benadryl is not a great idea either. Anytime you see something Tylenol PM means usually that there's Benadryl in there. So stay away from antihistamines. We think that they may actually make you more prone to dementia. That's another reason. And benzodiazepines do that too, as well as drinking alcohol. That's another thing, guys. Don't drink a lot of caffeine later in the day, and please don't drink alcohol to try to put yourself to sleep. It doesn't work, and it makes your sleep less beneficial to your body. If you know somebody that takes Xanax for sleep or is thinking about it or even asks you about it, please send this video to them. If you've enjoyed this video, give it a thumbs up. Please subscribe to my channel for more happy, healthy information. This video was recorded on riverside.fm. There's a link to this program down in the description section of this video. I strongly suggest checking it out. It makes recording a whole lot easier. You basically have a recording studio right on your screen. And you can use your cell phone as your webcam, which is what I'm doing right now. So all I have is this Samsung microphone over here, $50, and a nice cell phone that I use every day for everything to record this entire thing. I'm using a MacBook Pro, which makes it even easier. If you have any questions, please put them in the comments section. My name's Pharmacist Michael. Be happy and be healthy.